So what we're going to talk about very briefly today actually is goals. And I didn't want to do this like right before the new year or even like immediately after the new year. Because it's cliche and everybody's doing it at that point in time, but it's very normal and very appropriate when we begin a new year to be excited and wanting to set goals or talk about the new things or what we want to change or what we want to be better or who we're going to show up as. I mean, there's a million different things you could set goals for. And I wanted to talk with you a little bit about goals today and how I sit down at the beginning of every year to figure out what that's going to look like for the year. But I also wanted to just give some like practical tips and tell you to go easy on yourself and be gentle and kind because it's a lot of pressure to put on yourself to, especially if you want to change a whole bunch of things this year. Maybe you've taken the time, maybe you've watched a couple of my videos and then you've decided it's time to, set this amazing vision for your practice and you're going to completely change your new patient experience and you want to grow by 30% and you're going to offer more procedures or you're going to raise your fees or you're going to completely change the culture of your practice and communication with your team. There are so many things, especially as we learn about and see what's possible that we want to do, that they can feel like they just start to stack, but then it becomes completely overwhelming. I don't know if any of you have ever been in that place where it's like, oh, I want to change all of these things and they all sound so amazing and so fantastic. And then overwhelm starts to happen. Either we don't know where to start, or we don't know which one's more important, or we don't know how to start on each one. Like it has been broken down into baby steps, but sometimes it just feels like too much because it's so much change and it sort of just like feels impossible in some way. And I don't want you to get sucked into that trap. I used to do it to myself all the time. I would sit down and do my planning for the next year and I would have 25 initiatives of things I was going to change or fix or improve or do better or work on or focus on or track or whatever. And then I wouldn't, and then I'd beat myself up that I didn't get all of those things done. But that was too many things. It was too many things. So let's talk about what is a far more reasonable, realistic, possible way to set goals and to make changes and to do some pretty awesome freaking things in your life or in your practice, whatever you're focusing on. And that is to make between 1 and 3 goals only. And then I tell myself, I am not allowed to make any other goals until I've accomplished the ones I've already put out there. So if one of my big goals, let's say I'm going to do 3 goals. If one of those goals is an annual goal, it's going to take all 12 months to do it, then I don't get to add another goal until that one's completed, which that would mean until next year, 2026. Maybe a few of the other goals are little. Maybe something about culture or something about a marketing thing I want to try or something else. And if we accomplish that goal, then I can always reassess and add another goal. But don't ever have more than 1 to 3 changes on the go at any given time. It's just like straight up advice from a crazy change freak who's always trying to change everything all of the time. It's too many things. I've been asked several times by people how I figure out what my goals are going to be. And an exercise that I find very, very valuable if we're talking just about our practices, but you can do this in your regular life too, is to do a Groundhog's Day. So one thing I've already done, because myself and my partner and our associate is going to be in Florida for a meeting at the Women in Ortho Conference next week. And so we're staying for many, many days after the conference so we can do our partner retreat and do all of our planning. And so I've already done a whole bunch of printing off of reports and looking up information so that we can do as our first exercise a Groundhog's Day on 2024. Meaning, we look at all the things we did in 2024 from January through December, meaning new initiatives we tried to do, things we were tracking, all of our basic KPIs in a global sense, collections, production, our conversion rates, our referral base and sources, all of the things that we're always looking at for the health of the practice, the growth of the practice. I've already looked at our numbers to know that we, grew by about 25% last year. And so it's sitting down and figuring out, where did that growth happen? Were there certain initiatives that we can attribute to that growth? Were there things that we were trying or doing last year that really didn't help the bottom line that we need to drop? We're very big fans of spending money in order to make money, and it does work well for us. But sometimes you spend more money than you needed to get the result that you're getting, and so we're always going back to look. Is our overhead too high? Are we spending too much on things? Where's the balance? Where's the tipping point? Like, what does our ROI look like? And so we have to do a Groundhog's Day first. I really, really think it's important that you have data when you're setting goals. It's one thing to say, if we're not talking about practice revenues, new patient flow, like those things that you can like really, really track. If you're talking about something like practice culture, and let's say you're like, 2024 was filled with so much drama. I really, really want less drama this year. And if that's one of your big goals, then you may not have a measurable metric other than how you are feeling about things, or maybe how some of your team is feeling about things, to change that thing. But for all the things that you can measure, you should be setting your goals and looking at your results based on actual numbers, not gut feelings, actual data. And so when you're looking at something as an example of growth of your practice, and you're like, we only grew by 5% last year, I really wanted it to be 10. You need to be looking at hard data. Where did the growth occur? Where did shrinkage occur? Like you have to be able to take all of the data that you have so that you have facts laid out in front of you. You can remove the emotion or the feeling of some of those things out, and then start making plans and decisions and setting goals based on actual data. So I don't love numbers personally. Like I don't love collecting that stuff, but there's no way to set good goals and know where we are compared to where we want to be to then make the path to get there unless we actually have all of the data that shows us what's happened so far. When you're planning for the future, you have to use your past as the guide a little bit. It doesn't have to mean that your past defines what your future is, because I believe you can completely change what the future is. But your past is going to show you sort of what's happened so far. You know what you did in the last 12 months. So you can take a look at that and decide if what you were doing in those 12 months, if you want to repeat that, you want the same thing to happen this year, then you probably want to do a lot of the same things. If you want something to change, let's say you didn't grow as much as you wanted to last year and you really want to focus on growth this year, then you'll probably have to do a few things differently. Because one thing that I've learned, that I'm sure many of you have learned, is doing the same thing over and over again, expecting a different result, is the definition of insanity. So if what you got last year based on what you did last year is not what you want for this year, then you're going to have to do something differently. Now, you may not know what that is, and that's what people like me are around for, so shoot me a message. I'm happy to help you figure out what that thing is that you might need to do differently. But you're going to have to figure out where the different part is going to happen. Do you need to learn something new? Do you just need to do something different? Do you need to teach something? Do you need a new skill? Do you need a strategy? Do you need help from someone who's done it before, like an experienced person who's accomplished the thing that you want to accomplish? There's so many ways, a good book, so many ways you can learn about the things that maybe you are not yet the expert you want to be on, and then you can start doing teeny tiny things differently, and then that builds over time. When I talk with people about how our practice has grown, because growth of the practice has always been one of our goals, not necessarily a specific number. When Dina and I sit down to plan, we're not thinking about revenue per se, like, how much money we take home or that necessarily, but we are talking about growth because we know if a business isn't growing, it's shrinking. And because we want to keep employing awesome people in our practices, the practice has to be able to sustain those people. That includes us, that includes them, that includes all of the awesomeness that we want to provide to our patients, meaning we have to make more money each year in order to be able to provide all of those things. And so growth has always been an important part because growth has been important, and we've always set goals and we've always changed things and learned as we've gone. We've been very successful in that. But there is strategy that's important in goal setting. Just setting a goal, especially if you don't write it down, to me, that's not a goal. It has to be written down. When you're setting goals, the goal needs to be a stretch, okay? A little bit of a stretch, not unrealistic, but a stretch. You want something that you're going to push yourself for. And it needs to be based on data as much as possible. Those are probably the two biggest pieces of advice I can give you. Another thing that I know I've spoken about before, when you set goals, if you tell other people, that can mean your spouse, that can mean your team, that can mean, who knows, me. When you tell other people about the goals you have set, you are 75% more likely to accomplish them. That's huge. And that comes from peer pressure, accountability, all of those things. It's a psychological thing, but that's awesome to know. So writing it down, the most important thing you can do for a goal. Most people don't hit any goals they don't write down. So write it down and tell somebody about it. And if you do those two things and those goals are realistic and not too many of them, then you can probably do anything. Now, my last piece of advice when it comes to goals. What we do is Groundhog Day first. Then we talk about what our vision is for the next 12 months and pick our 1 to 3 things. Now, sometimes we have an annual goal, like one big annual goal, 30% growth. That's our annual goal. And sometimes we have quarterly or 6-month goals, right? And you can do this too. But again, never working on more than 1 to 3 things at a time. But then you have to take that goal and break it down backwards so that you know what you need to be doing to hit that goal, to make sure you're tracking it. Because the things that you track, that you observe, that you watch, that you care about are also the things that will change. So if, as an example, and I'm not saying everyone's trying to make more money, but we all need to make money. If, let's say, you set a 30% growth goal. So let's say you made $1 million in 2024. And you're like, we're going to do 1.3 this year. Okay? Then you can work out how much do we need to collect each month? How much do we need to collect each week? How much do we need to collect each day? How much should we be making per hour? And then you can decide how you want to take those KPIs and track them over time. Because you're going to need to monitor how you're doing so that you can then continually adjust, change, try new things, all of those things in order to hit that goal. If you just say on today's January 8th, if you just say on January 8th, I'm going to make $1.3 million this year, and you write it down somewhere and you tell somebody else, and you do nothing else towards getting to that goal, it's probably not going to happen. But if you say, this is the goal, and you've broken it down, and you've said, you know what, that means we have to make this much per day, this much per week, this much per month. I've sat down and figured out that our most profitable procedures are these 3 things. That means we want to do more of these 3, or maybe you just like one of them a lot. We're going to do a whole lot more of this one thing. Let's say you've decided that dental implants are your most profitable procedure. You're like, you know what? We need more dental implants. If we do more dental implants, because it's one of our most profitable procedures, I believe we can hit that 30% growth goal. That means we need this many more implant procedures done per day, per week, per month, per quarter. If we want to get more dental implant patients, how are we going to do that? And then you can start talking about initiatives, right? Are we going to work on our website? Are we going to work on our SEO? Are we going to start doing digital marketing? Are we going to reach out to people in the community? You could brainstorm all of the different ways that you could try to find and get more dental implant patients into your practice. Maybe it's about educating your hygienists and your assistants to talk to people more about dental implants so that more people who you're already seeing and who are already your existing patients say yes to dental implant treatment. Maybe it's about the visuals you're using when you're presenting. Maybe it's about, it could be so many things. Maybe it's how you package dental implants. Maybe right now you offer it a lot, but people say no more than they should. So maybe it's about case presentation. There's a million places where there might be changes that will help you accomplish this goal. But you need to have all of those little pieces in place. Otherwise, it just doesn't usually work out in the way that you want it to. And although this planning takes some time, sometimes a lot of time, it's absolutely worth it because that's how you make sure that the things that you want to accomplish happen. I joke all the time that I've been setting goals for so long now and I've really never not hit a goal. It's only because I do it this way and we track things and we are on top of things and we're constantly changing things to figure this out. You will never get to success without failure. There's another lesson for you. So you may say we need more dental implant patients and it takes you 2 months to get a single more dental implant patients than you've ever had before because it took 2 months to figure out what's actually going to work on the dental implant front. But if you, after the first month of not getting any more dental implant patients, just gave up because you tried, putting some ads out there and it just didn't work, well, of course you're not going to hit that goal. There's going to be hiccups. There's going to be bumps in the road, and it's about continuing and learning and trying again and doing again. The people who fail are just the people who give up. But the people who have failures will have failure, success. Always. It will inevitably get to success as long as you don't stop. So keep learning, keep asking questions, and do the planning, get the data, set the goals. Do not make it too many goals. Okay? That's the biggest mistake I see people make is I'm going to overhaul everything. Well, you can't. That's impossible. That's like torture to yourself. Don't do that. Figure out what are the most critically important things to you and work on those first. Then you can add in the other stuff, right? What's going to move the needle most? Maybe right now you hate being at work, and so the vibe, the mood of the practice means more than anything else. Then work on that. Maybe it is a money thing. You're like, man, these student loans are huge. I'm still paying them off. Or I have this practice loan and it's massive, and or my kid's gonna go to university next year and need more money. Whatever it is, if the finance part is the most important part, great. There's lots and lots of ways to make more money in a dental practice. So you just gotta figure out which way feels good to you. I hope that so many of you have already, started thinking about planning, like making some goals for the next year. And this is something you really should be doing all the time. You set goals. Like I like the beginning of the year to kind of do my really big planning, and then we reevaluate, reassess the whole year. And sometimes we change our goals. Sometimes we change our mind and we decide there's something else that's more important than the thing we thought was most important. That's okay. Who cares? It's your goals. You can do whatever you want. But it's about making sure you have taken the time to make them wisely. You're taking the time to track them. You don't have too many things on the go, and don't beat yourself up. Don't beat yourself up ever. There's actually no reason to do that ever. There's always someone to learn from. There's always another thing you can try. There is no dead end. There is no end. The sky's the limit, and you've got a bazillion resources. Like, everyone has the same resources. So you have all these resources. You'll figure it out. You always can. Just ask. Ask someone if you don't know. I promise there's lots of people who've done it before who can point you to a resource or something that will help. So there's my little spiel on goal setting. I'm looking forward to next week when we get to do ours, because it's going to be so much fun. I love having goals. I also love making change, so those two things go hand in hand. I'll be back next Wednesday. Maybe next time I'll remember to send you guys an email before I do one of these so everybody knows what it's all about. I'll probably shoot you guys all an email now for anybody who, because usually nobody's around when I'm doing these, but just so you guys all know this is here. You want to learn something a little bit about goals or the way that I do it, then this video's here for you. Have a wonderful day. I'll see you guys later.